advice all packed together in the next half an hour. Let's begin with the top 10 updates at this hour. Cabinet Secretary asked states to take steps on war footing to trace attendees of Tablighi-Jamaat congregation in Delhi. There are reports that nearly 200 of the delegates have been found corona positive. 10 have died. Health Ministry too admits that the sudden spike in corona positive cases in the country is largely due to affected Tablighi congregation. Attendees ask people to take adequate preparation to halt the spread. World Health Organization praises Prime Minister Narendra Modi for initiating landmark measures to help the poor and underprivileged sections during the corona crisis. Union Health Minister Dr. Harshvardhan holds meeting with Indian Medical Association to review preparedness and action to deal with COVID-19 crisis. Says prevention, containment and management of COVID-19 are being monitored at the highest level. India sees largest single-day spike in corona cases. Total number of active cases stand around 1,700 with 50 deaths. In worst affected Maharashtra, corona positive cases are more than 300. Tamil Nadu sees biggest jump in positive cases due to Tablighi attendees. Ram Navami today, people offer prayers staying at home. Temples remain closed. President, Vice President and Prime Minister greet people on the occasion. War against corona continues across the world. The number of infected people crosses the 9 lakh mark. US alone, total number of positive cases crosses 2 lakhs. US registers nearly 900 deaths in a single day, while UK registers more than 500 deaths in the last 24 hours. This year's Wimbledon cancelled due to corona outbreak will be held in July next year. This has happened for the first time in history after World War II, when the premier tennis tournament has been cancelled. Let's now take stock of the key developments in India vis-a-vis COVID-19 in Ground Zero. The COVID-19 outbreak in India due to infected members of Tablighi-Jamaat has become grave. More than 200 delegates have been reported corona positive so far. At least 10 people who've died had attended the congregation in mid-March in Delhi. Centre has taken up the challenge of identifying the delegates and the people with whom they came into contact to contain the damage. In this regard, Cabinet Secretary Rajiv Gauba yesterday held a high-level meeting with Chief Secretaries and DGPs of states through video conferencing and asked them to track the Jamaat members on a war footing so that the preventive measures can be taken up to contain the infection. Meanwhile, even the Health Ministry has now confirmed that sudden spike in number of corona cases in the past 24 hours is largely due to infected delegates from the congregation of Tablighi-Jamaat in Delhi. These delegates then spread all across the country, coming into contact with 1,000 others, multiplying the infection. Meanwhile, Jamiyat-e-Ulema-e-Hind President Maulana Arshad Madani has appealed to people to follow social distancing religiously.
मैं लोगों से अपील करता हूं कि इस मर्ज का कोई इलाज अब तक नहीं दरियाफ्त हो सका, इसलिए एहतियाती तदबीर में सबसे ज़्यादा मौसर तदबीर यही है कि लोग किसी जगह इकट्ठे न हों। मैं मुसलमानों से भी कहूँगा, हिंदुओं से भी कहूँगा कि इस तरह के वाक़यात न होने चाहिए।
My colleague Arun Sharma is joining me now with more updates on the coronavirus outbreak. Arun, the priority of the administration as of now seems to be to do contact tracing of the Jamaat members to contain the infection. What progress has been made on that?
Well, that's right. Now, various authorities are working on a war footing to trace the people who were part of this congregation, and of course, they're trying to make a very active, engagements and trying to trace the people who have attended or who have been in contact with these attendees of the congregation. Now, the good news is that so far, in last, you can say, 24 to 48 hours, close to 7,700 people have been traced by the government and various authorities. And these are the Indians who attended the congregation, and these people have been, traced, and most of them have been quarantined by the authorities. Some foreign people who had a foreign visit history, all those who came to India and attended the congregation, they were also being, traced by the authorities, and most of them are in the quarantine now. So close to 9,000 people, you can say, that have been traced by the government and the authorities, and most of them have been put in quarantine as of now. That's a good news as of now that's coming in. Second important part, as the cabinet secretary, yesterday held a meeting via through video conferencing with the state DGPs and chief secretaries. It was a clear message by the cabinet secretary that the contact tracing should be done on war footing, and the states and centers should work in coordination as far as the contact tracing is concerned. Second important aspect was that awareness. I mean, most of the DGPs yesterday did a press conference and said that there should be awareness and people should come forward on their own, and they should accept and tell us whether they have been the part of the congregation or they have been in contact with the person who attended the congregation. Because every country as of now is trying to flatten the curve, and as health ministry also said that, Shubhendu, that recent spike in the numbers of positive people is because of this congregation. So yes, the government is making all the efforts, for the contact tracing as of now.
And Arun, in the larger context of preparedness to tackle coronavirus outbreak, as far as getting COVID special hospitals ready, equipment like ventilators ready, what progress on that front?
Well, government is leaving no stone unturned as far as, providing ventilators and masks. And private players are also being roped in as of now by the government. We know this fact that DRDO has come out with various measures, and they're providing now the multifunctional ventilators. They'll be manufacturing the masks, the N99 masks. They're also working out on testing kits, which is economic as of now, worth 1,200 rupees, and you can do tests. So government is ensuring now and making progress that more and more tests can be done. We know that, close to 48,000, 50,000 tests have been done so far. But now government is ensuring that more tests can be done, and that's the reason why more and more companies are coming forward. Bharat Electronics has come forward, and they'll be manufacturing close to 30,000 ventilators going forward. Automobile manufacturers of our country have been roped in to, develop or manufacture the ventilators going forward. So yes, government is ensuring on one side that they have complete infrastructure, the health infrastructure to combat COVID-19. So on the other side, it is also, creating health awareness and constantly appealing to people to stay at home and to maintain social distancing.
All right there, Arun, thanks very much for joining us with those inputs. World Health Organization has praised Prime Minister Narendra Modi for his efforts to inclusively fight COVID-19 pandemic. WHO Director General Tedros Adhanom gave example of Prime Minister Modi to the world, the way India has implemented social welfare measures for the poor to combat economic consequences during COVID-19 pandemic.
Many countries are asking people to stay at home and shutting down population movement, which can help to limit transmission of the virus, but can have unintended consequences for the poorest and most vulnerable people. I have called on governments to put in place social welfare measures to ensure vulnerable people have food and other life essentials during this crisis. In India, for example, Prime Minister Modi has announced a $24 billion package, including free food rations for 800 million disadvantaged people, cash transfers to 204 million poor women, and free cooking of gas for 80 million households for the next 3 months. Many developing countries will struggle to implement social welfare programs of this nature. For those countries, debt relief is essential to enable
As the nation completed 7 days of lockdown, active cases of COVID-19 reached 1,764. 150 people have been cured of the infection and they've been discharged from hospitals. While a total number of 50 people have died due to this virus, centre and states are working together to contain the spread of the virus and trace contacts of the affected persons. Briefing the media, Health Ministry said that as many as 6 lakh people are living in makeshift camps. Over 25 lakh migrant workers who are rushing home were provided with food at relief camps. Centre has also said some 47,951 tests have been conducted till date. There are 126 labs in ICMR network, including 51 private labs that have been approved for testing COVID cases. And Union Health Minister Dr. Harshvardhan reviewed the action taken and preparedness on novel coronavirus with Indian Medical Association at the high-level meeting through video conferencing in New Delhi. During the meeting, he reviewed the preparedness and concerns of medical staff across the country related to COVID-19. The minister reviewed the status of preparedness in terms of availability of beds, isolation wards, lab readiness for high test volumes. He said that IMA and its regional members will make a task force and take proactive role in helping the official machinery at state, district and local levels. And Health Minister Dr. Harshvardhan has stated that prevention, containment and management of COVID-19 are being monitored at the highest level, and various actions have been initiated in collaboration with the states. In an exclusive interview to DD News, he reiterated the resolve and said the government is committed to preventing the spread of COVID-19 and will take all extreme preemptive steps available to stop the spread.
We have a well laid down criteria which is quite thorough and comprehensive, where we are even testing every patient who has an acute respiratory illness and is admitted in a hospital. He is also being tested. It's not only a person who has a history of contact with a COVID affected or an international travel, but it is also a person who has an acute respiratory thing.
He also said that India is following a specific laid down criteria to do all the testings.
Community surveillance that we started on 17th of January. Can you believe it, when I am talking to you today, we have more than 5 lakh people in this country who are under community surveillance, and our health system, with the help of our other you can say grassroots workers like surveillance officers and rapid response teams, etc., and ASHA workers, we are keeping you can say very close watch on these people. If he or she is an old person, virtually it's a daily contact with them. So a watch is being done with the help of all the officers of the and the administrative machinery. We are being helped by the Home Ministry people, we are being helped by the DMs, we are being helped by, it's not only the health department, it's the whole government which is working.
And amidst the disease outbreak, the festival of Ram Navami is being celebrated across the nation today. President Ramnath Kovind, Vice President M. Venkaiah Naidu, Prime Minister Narendra Modi greeted the nation on the auspicious occasion of Ram Navami. However, due to lockdown, devotees offered prayers at their homes while the temples remain empty. In the national capital, the famous Lakshmi Narayan temple was seen empty. Sikh spiritual singer Padma Shri recipient Nirmal Singh died of coronavirus in Punjab early this morning. Nirmal Singh was a former Huzuri Ragi at the Golden Temple. Singh had recently returned after a trip abroad and was admitted to a hospital after he complained of breathlessness and dizziness on March 30th. And celebrities have taken to social media to ask fans to stay home, stay safe amid coronavirus scare. They urge people to stay at home and follow the precautionary measure to fight against coronavirus pandemic.
नमस्कार, मैं आशा भोसले। दिल चीज क्या है, आप मेरी जान ले लीजिए, बस एक बार मेरा कहा मान लीजिए। मेरा कहना यही है कि आप अपने घरों से मत निकलिए, क्योंकि हमारा भारत देश बड़ी लड़ाई लड़ रहा है और इस लड़ाई में हमें जीतना है और हम ये लड़ाई जीतेंगे, जरूर जीतेंगे। मुझे विश्वास है कि हम जीतेंगे। जय हिंद।
Very small basic things that we all can take care of. If you're stepping out to buy grocery, make sure that you're at least at a 6 feet distance from each other. Do not touch anything, wear a mask, do not touch your face, come back, wash your hands for at least 20 seconds, sanitize everything that you've touched. अगर आप अपनी लिफ्ट में जा रहे हैं तो लिफ्ट का बटन हाथ से नहीं दबाएं, एल्बो से दबाएं. If you're a righty, use your left hand to open all the doors and turn knobs. Stay positive, stay fit, stay at home.
The Press Information Bureau of Ministry of Information Broadcasting has set up a portal, COVID-19 Fact Check Unit, that will be operational from 2nd April 2020 to receive messages by email and send response in quick time. Ministry of Health has set up a technical group comprising professionals from AIIMS and other hospitals to clarify any doubts in the minds of public on any technical aspect of COVID-19. The Press Information Bureau will release a daily bulletin at 8 p.m. every day to inform regarding government's decisions and developments and progress made on COVID-19. First bulletin was released on Wednesday at 6:30 p.m. Time now for some good news that give us hope in the fight against COVID-19. Now, contributing towards efforts to contain COVID-19 pandemic as a gesture of goodwill towards local population under distress during nationwide lockdown, Goa Naval Area undertook distribution of essential supplies yesterday. The headquarters, Global Naval Area, coordinated with Councillor of Mangaur Hill and distributed critical supplies to families of daily wagers, migrant labourers and low-income families at Gandhinagar near Ayappa Temple in Varunapuri. In addition, provisions were handed over to Milad Naik, Minister for Urban Development and Social Welfare, for distribution to families in need. Naval Dockyard Mumbai has designed and developed its own handheld IR-based temperature sensor for undertaking screening of large number of personnel at entry gates of the yard, reducing the load on security sentries at the gate. The instrument has been manufactured under rupees 1,000 through in-house resources, which is in fact a fraction of cost of the temperature guns in the market that are available at the moment. Since the outbreak, the non-contact thermometers or temperature guns have become scarce in the market and are being sold at a rather high cost. As the nation fights against the outbreak of coronavirus, people from all over the nation support to fight against this deadly virus. A 7-year-old from Mizoram also lent the helping hand in support against the virus, contributing his entire savings. Romel Lalamuasanga from Kolasib, Venglai, donated his savings, rupees 333, to his village-level task forces in the war against the dreaded COVID-19 pandemic. And Mizoram Chief Minister Zoramthanga lauded the contribution made by Romel. In a tweet message, he expressed gratitude for the contribution, called him a hero for his generous contribution. Let us now look at some international updates in World Wrap. More than 9 lakh cases of coronavirus have been officially detected worldwide since the pandemic emerged in China late last year. Over 9 lakh infections, including 45,719 deaths, have been recorded in some 187 countries and territories globally. 2,03,608 cases in America alone. 4,476 deaths have been reported in the US, where pandemic is spreading rapidly. Italy, with 1,10,574 detected cases, has the highest number of fatalities with over 13,100 deaths. Spain has detected 1,02,000 cases over that, including over 9,000 deaths. Meanwhile, China has somewhere stabilized around over 81,500 cases and 3,312 casualties. And World Health Organization has said it was deeply concerned about the near exponential escalation of the new coronavirus pandemic. As the number of deaths doubled in a week, WHO chief urged citizens around the globe to stand together to fight COVID-19. WHO also warned about the serious social, economic, political consequences in the African region that could turn up if the confirmed cases of COVID-19 start spreading in the continent. The WHO chief urged governments to implement social welfare measures to ensure that vulnerable people have access to food during the crisis and called for debt relief for poorer states. Meanwhile, he also mentioned that a safe vaccine is thought to be some about 12 to 18 months away, so more than a year really, and recommended people to wear masks who are infected or are health workers. A Russian military plane carrying medical supply has arrived in the US. The plane landed at New York. That's the epicenter of coronavirus outbreak in the United States. Russia has previously sent medical supplies and experts to coronavirus hit Italy as part of a humanitarian effort. The US now has more than 206,000 confirmed coronavirus cases. This is by far the highest in any country. Some 4,500 deaths have also been reported in the US. In Colombia, police is resorting to creative methods to urge citizens to stay in their homes during the quarantine to prevent further spreading of coronavirus. In Medellin, a funeral car was used to issue alert messages for citizens to stay in their homes during the state of emergency. In the northern Colombian city of Barranquilla, police used drones with loudspeakers to warn people to stay at home. However, Colombian police also entertained the people by singing. Since Wednesday, Colombia began a nationwide lockdown until April 13th with strict movement restrictions across the country designed to reduce community spreading of the virus. Colombia has reported over 700 cases of the disease and 3 deaths have been reported so far. It has also impacted the world of sports. Wimbledon has been cancelled for the first time since World War II because of the coronavirus pandemic. The tournament was due to be played between June 29th to July 12th. The entire grass court season has been abandoned. There will be no professional tennis anywhere in the world until at least 13th of July. Wimbledon is the latest major summer sporting event to be called off, with Euro 2020, Tokyo Olympics also postponed for at least 12 months. It follows the postponement of the French Open that was due to begin in May but has been rescheduled to 20th September to 4th October period. We now get you some expert medical advice in Dr. Speak. Now, WHO has busted some crucial myths that are doing round on social media. It is important to be aware of the facts about COVID-19. We'll talk about them through the means of these graphics. We'll play them one after the other and we'll talk about that. If you can have the first graphic ready. So the fact is the new coronavirus can be transmitted in areas, hot and humid climates as well. So sunlight, sun, hot weather is not going to kill coronavirus. We have to be careful irrespective of what kind of climate conditions we are in. We'll move to the next fact and we'll quickly keep looking at the important points made by WHO. Drinking alcohol does not protect you against COVID-19 and can be dangerous. Alcohol is good in hand sanitizers as of now. Drinking alcohol is not going to protect you from COVID-19. So important to bust that myth that WHO has done now in its directive. Moving on, being able to hold your breath for 10 seconds or more without coughing or feeling discomfort does not guarantee that you are free from coronavirus or any other lung disease for that matter. So these exercises are not the authentic way to diagnose if you have coronavirus. If you have the symptoms that we talk about, go get yourself tested and checked. Moving on, the directives that WHO has spoken about, like hot and humid weather, cold weather and snow also cannot kill the coronavirus. Temperature, as we see, the weather does not have any impact on the spread or the end of coronavirus as such. So whether you're in hot weather or cold weather, do not take an assumption that the weather itself will bring an end to this outbreak. We have to be careful. Staying at home, social distancing is the norm. Moving on to the next point. Taking a hot bath does not prevent the new coronavirus disease again. This misconception that hot water, hot climate, sunny day can perhaps help us remain healthy and help us safe from coronavirus, well, that's not happening. We'll have to be careful and follow the precautions that have been spoken about. So taking hot water bath does not help. Important fact reinstated by the WHO. Moving on, another fact, you can recover from coronavirus disease. Catching the new coronavirus does not mean you will have it for life. So you see increasing percentage of people are getting healed across the world. Having coronavirus does not mean you're going to be sick for life. The symptoms are being treated also. The vaccination is still under development. After treatment of symptoms, people are recovering back to health. So you don't have to worry about coronavirus being a permanent. Also, the new coronavirus cannot be transmitted through mosquito bites. Another misconception busted by the WHO. Mosquitoes can transfer a number of diseases like malaria, dengue, but not coronavirus. That fact needs to be established very clearly, especially now that the humid summer season is here in India in particular. So another fact made clear by the WHO. And exposing yourself to the sun or to temperatures higher. The point that we're making again and again, high temperature will not protect you against coronavirus. In fact, it can rather make you feel sick and dehydrate you further. So high temperature, standing in the sun, or cold temperature on the other hand, is not going to be able to protect you from coronavirus. Take the precautions of social distancing, hand hygiene that we have been talking about, that the message that we've been bringing about, and avoid falling into a trap of such myths and rumors, the facts established by the WHO. So those are some of the ways you today learnt about the different facts about coronavirus. Keep the rumors and myths at bay. Follow the simple precautions. Wash your hands. Maintain good hygiene. Stay at home. Stay safe. That's the wish we have for all of us. Namaskar.
The conches cell has an incredible legacy in India. Blowing conches are an important part of religious ceremonies for millions of Hindus across the country. The ancient Indian epics of Ramayana and Mahabharata make frequent references to the use of conch as ceremonial trumpet and as a libation vessel. It is also speculated that the conches, with its deep sonorous boom, is perhaps the origin of the sacred syllable Om. According to traditional belief of the Hindus, blowing conches is said to ward off evil spirits. It also served as a device to call the people to their religious rites and attract the attention of the deities to the ceremonies being performed.
শাঁখ বাজাতে হয়, এটা একটা মঙ্গলসূচক ধ্বনি শাঁখের। আর অন্যান্য বাদ্যযন্ত্রের মতো হিন্দুদের শাঁখও পুজোর একটা মস্ত বড় অঙ্গ বিশেষ। এই জন্য ঠাকুর দেবতা আমরা পুজোর আগেই ঠাকুর দেবতাদের শাঁখ বাজিয়ে আবাহন করি, তেমনি পুজোর শেষে এই শাঁখ বাজিয়ে তাদের বিসর্জন দিই।
Kilakarai, a coastal village adjoining the Gulf of Mannar in southern state of Tamil Nadu, is one of the major hubs for crafting this ancient and traditional device. It is from here that find their way to altars and places of worships. And for the craftsmen and fishermen who are involved in this profession, they have to brave the wilderness of the sea to collect them, diving into its depth with no more apparatus than a face mask, a diving stone and a nylon rope bag into which they are gathered. As conches are living sea animals, immediately after their catch are brought to the shore and are processed. The processing include various, including chemical coating, acid wash and roasting in boiling oil to remove the mollusk. The conches prepared for blowing are usually between 8 to 4 inches long. The tip is removed by a hammer and polished smooth, and a spiral of flower motifs are engraved into the shell.
हमारा बोलते शंख इधर उतना समुद्र से इधर बाजू से रहने के जाए से उतना से शंख आता है आने के वक्त तो शंख कच्चा रहता है और शंख निकाल के अब हम लोग पॉलिश करते हैं इसी में बंगाल की चूड़ियाँ बनाने के लिए और दूसरा मंदिर के लिए बजने के लिए ये सब माल मिल जाता है.
Conches are inextricably weaved with the traditional Indian culture. From the earliest times till the present day, they have had a defining presence in the life of the people of this country.
Prime Minister Narendra Modi interacts with chief ministers via video conferencing to discuss measures to combat COVID-19, urges chief ministers to increase focus on tracing, isolation and quarantine, outlines the common goal for the country is to ensure minimum loss of life. PM praises states for working together as a team to check the spread of the virus, says states and centre must formulate a common exit strategy to ensure staggered re-emergence of population once lockdown ends. PM Modi asked CMs to reach out to community leaders and social welfare organizations, adopt community approach in the battle against the pandemic. Chief Minister briefed steps taken to contain spread of cases arising from Nizamuddin Markaz. Home Ministry intensifies campaign with states and union territories, identifies 9,000 people associated with Tablighi Jamaat. Among them are 1,306 foreign nationals. Health Ministry says 80